explore the complex history of some of the world's most devastating pandemics, from the Plague of Athens to the ongoing COVID-19 crisis. This comprehensive analysis examines the health, psychological, sociological, and economic consequences of these global health crises, revealing how each pandemic has shaped and transformed societies throughout history. Discover humanity's resilience and vulnerability in the face of deadly viruses, and understand the enduring legacies these pandemics have left on the world. Let's get started. Plague of Athens, 430 to 426 BCE. Disease and effects. The Plague of Athens struck the city during the second year of the Peloponnesian War in 430 BCE. It is believed that the disease originated in Ethiopia, traveled through Egypt and the Persian Empire, and eventually reached Athens. The plague killed approximately one-third of the population and significantly weakened the city's defenses. This epidemic played a major role in Athens' defeat by Sparta. Virus and symptoms. While the exact virus responsible for the plague is unknown, symptoms included high fever, redness in the eyes, throat bleeding, and skin rashes. The ancient Greek historian Thucydides documented how the plague profoundly shook the society of the time. Today, possible causes of the epidemic are thought to include typhus, smallpox, or viral diseases like Ebola. Psychological and sociological impacts. The Plague of Athens had deep psychological effects on society. Fear, helplessness, and a pervasive dread of death spread among the people, leading to the breakdown of social order. During the plague, moral values deteriorated, and traditional practices and social norms changed rapidly. Individuals began questioning their beliefs and moral values in the face of death, resulting in widespread despair and social chaos. Economic impacts. The loss of life in Athens led to a sharp decline in agricultural production and trade. The reduction in the labor force caused economic activities to come to a near standstill. This economic decline weakened the city-state's military defenses and hastened Athens' defeat by Sparta. Justinian Plague, 541 to 750 CE. Disease and effects. The Justinian Plague first appeared in 541 CE in Constantinople, modern-day Istanbul, the capital of the Byzantine Empire. The disease spread rapidly across Europe, Asia, and Africa, devastating the population around the Mediterranean basin. The plague significantly weakened the Byzantine Empire and hindered efforts to reunify the Roman Empire. Virus and symptoms. This plague was caused by the bacterium Yersinia pestis, transmitted by fleas that infested rats. The Justinian plague manifested with swollen lymph nodes, buboes, high fever, chills, headaches, and muscle pains. Even Emperor Justinian contracted the disease but miraculously recovered. The bodies of the deceased filled the streets, cemeteries overflowed, and corpses had to be thrown into the sea. Psychological and sociological impacts. The Justinian plague severely undermined the psychological resilience of the population. Fear of death deeply affected people's beliefs and daily lives. Social bonds weakened, many people lost loved ones, and a sense of widespread helplessness prevailed. Religious beliefs grew stronger as many viewed the plague as divine punishment, leading to an increase in religious practices. However, this period also saw crises of faith, as people began to question why God would allow such widespread suffering. Economic impacts. The plague collapsed the Byzantine Empire's economy. Agricultural, trade, and artisanal production nearly came to a halt. The empire could no longer sustain military expenditures, leading to territorial losses and the empire's decline. In the long run, the plague hastened the collapse of the Western Roman Empire. The Black Death, 1347 to 1351. Disease and effects. The Black Death is one of the most devastating pandemics in European history. Spreading from Asia to Europe in the mid-14th century, the plague killed approximately 150 million people on the continent. The epidemic profoundly affected Europe's social, economic, and religious structures, leaving many areas abandoned. Virus and symptoms. The plague was primarily caused by the bacterium Yersinia pestis, transmitted by fleas that infested rats. The Black Death was characterized by large, painful swellings, buboes, in various parts of the body, high fever, bloody cough, and rapid death. The disease spread rapidly, partly due to Mongol armies launching infected corpses into besieged cities. The Black Death's impact was so profound that it completely altered Europe's demographic landscape and played a crucial role in the decline of the feudal system. Psychological and sociological impacts. The Black Death caused deep psychological trauma across Europe. Death became an integral part of daily life, and people struggled to cope with the loss of loved ones. Religious beliefs were strengthened, as many viewed the plague as divine punishment, leading to an increase in religious observance. However, some blamed the clergy, resulting in distrust towards the church and paving the way for reform movements. The plague also transformed social structures. Peasants and workers began to demand more rights and higher wages in a labor-scarce environment. Economic impacts. The epidemic drastically changed Europe's economic landscape. The large population loss resulted in a severe labor shortage, leading to declines in agriculture and production. The feudal system began to collapse, and landowners were forced to offer more freedoms and better living conditions to peasants to address the labor shortfall. This shift contributed to social and economic transformations in Europe and laid the groundwork for the Renaissance. Spanish flu, 1918 to 1920. Disease and effects. The Spanish flu emerged in 1918, immediately following World War I. The war's devastation and poor living conditions facilitated the rapid spread of the virus. Infecting 500 million people worldwide, the flu caused approximately 50 million deaths. It is considered one of the deadliest pandemics in history. Virus and symptoms. The virus responsible for the Spanish flu was a strain of the H1N1 influenza virus. It primarily targeted the immunocompromised, the young, the elderly, and the sick. Symptoms included sudden high fever, coughing, headaches, muscle aches, and respiratory difficulties. The virus quickly caused lung infections, leading to pneumonia. The disease was named Spanish flu because Spain, which was neutral during the war, reported on the outbreak extensively, unlike other countries that censored the news. Psychological and sociological impacts. The Spanish flu arrived on the heels of World War I, exacerbating the despair and hopelessness that gripped societies. People, already worn out by the war, had to contend with this devastating epidemic. The flu caused widespread social isolation, grief, and loss, leading to significant psychological trauma. Many lost loved ones, weakening social bonds. Schools, churches, and public spaces were closed, further restricting social interaction. Economic impacts. The Spanish flu exacerbated the economic damage caused by the war. Losses in the workforce led to significant disruptions in production and services. Economic stagnation increased unemployment and social unrest. The epidemic also strained healthcare systems, with hospitals overwhelmed and medical supplies running low. These factors delayed the recovery of the global economy. Asian flu, 1957 to 1958. Disease and effects. The Asian flu, a strain of avian influenza, originated in China in 1957. The virus quickly spread worldwide, significantly affecting the United States. The Asian flu caused 1.1 million deaths globally. Virus and symptoms. The Asian flu was caused by the H2N2 virus, a strain of avian influenza transmitted from birds to humans. Symptoms were similar to those of seasonal flu: high fever, cough, sore throat, muscle aches, and fatigue. The virus began spreading in China in early 1957, reached Hong Kong and Singapore soon after, and eventually spread to the United States. The pandemic infected millions of people worldwide and resulted in high mortality rates. Psychological and sociological impacts. The Asian flu caused widespread fear and anxiety in society. People felt helpless in the face of the disease's rapid spread and high mortality rate. Media coverage of the pandemic's spread and impact heightened public concern. Despite this, social bonds and community solidarity strengthened as people came together to support one another. Economic impacts. The pandemic had a noticeable impact on the global economy. Workforce absenteeism due to illness led to disruptions in production and services. In Asia and the United States, economic activity slowed, and trade volumes declined. Increased healthcare costs placed an additional financial burden on governments. HIV/AIDS pandemic, 1980s present. Disease and effects. The HIV/AIDS pandemic was first identified in the early 1980s and has since claimed over 35 million lives worldwide. The disease has caused significant social, economic, and health challenges globally. The HIV virus attacks the immune system, leaving the body vulnerable to other infections. Virus and symptoms. The human immunodeficiency virus, HIV, targets and gradually destroys the immune system's cells, leading to acquired immunodeficiency syndrome, AIDS, a condition where the immune system collapses. HIV is typically transmitted through sexual contact, blood, or from mother to child. Initial symptoms may resemble the flu, but over time, the body weakens, and opportunistic infections become life-threatening. Although antiretroviral treatments now allow HIV to be managed, there is still no cure. Psychological and sociological impacts. The early years of the HIV/AIDS pandemic were marked by widespread fear and stigma. HIV-positive individuals faced social ostracism and discrimination. Lack of knowledge about the disease's transmission fueled fear and misinformation, leading to increased social isolation and higher rates of depression. However, as awareness grew over time, more support and resources became available for those living with HIV/AIDS. Economic impacts. HIV/AIDS has imposed a significant economic burden on individuals and societies. The disease has led to workforce loss, decreased productivity, and immense pressure on healthcare systems. In Africa, in particular, the pandemic has severely hindered economic development. Increased healthcare costs limited spending in other areas such as education and social services. However, international aid and HIV/AIDS prevention programs have helped mitigate the impact in many countries. H1N1 swine flu, 2009 to 2010. Disease and effects. The H1N1 swine flu emerged in Mexico in 2009 and quickly spread worldwide, becoming a pandemic. The virus infected millions of people globally, leading the World Health Organization to declare it the first pandemic of the 21st century. Virus and symptoms. The H1N1 virus is a subtype of the influenza A virus that can infect both humans and pigs. Symptoms of swine flu were similar to those of seasonal flu: high fever, cough, sore throat, body aches, headaches, chills, and fatigue. This virus led to high mortality rates, especially among young adults and children. By the end of the pandemic, the H1N1 virus had caused an estimated 151,700 to 575,400 deaths worldwide. Psychological and sociological impacts. The H1N1 pandemic generated widespread fear and anxiety globally. Continuous media coverage of the virus's spread and impact increased public anxiety. The pandemic led to significant restrictions on social life through social distancing measures and quarantine protocols. However, it also highlighted the importance of healthcare systems and public health measures, leading to increased investments in these areas in many countries. Economic impacts. The H1N1 pandemic had limited but significant economic impacts. The tourism and travel industries were particularly affected, and the economic growth rate slowed in some countries. However, the pandemic's economic effects were mitigated by swift measures in the development of vaccines, preventing long-term economic damage. Ebola outbreak, 2014 to 2016. Disease and effects. The Ebola outbreak began in West Africa in 2014, causing devastation particularly in Sierra Leone, Liberia, and Guinea. The outbreak sparked global panic and evolved into a global health crisis. Ebola is known for its high mortality rates and rapid spread. Virus and symptoms. The Ebola virus belongs to the filoviridi family and causes severe viral hemorrhagic fever. The virus spreads through direct contact with the bodily fluids of infected individuals. Symptoms of Ebola include sudden high fever, muscle pain, headache, sore throat, followed by vomiting, diarrhea, rash, kidney and liver failure, and internal and external bleeding. The outbreak led to 28,600 cases and 11,325 deaths in West Africa. Psychological and sociological impacts. The Ebola outbreak created widespread fear and panic. The virus's high mortality rate and rapid spread caused people to avoid contact with others, leading to increased social isolation. Cultural practices, such as funeral rites, were scrutinized as they were believed to contribute to the spread of the virus. The Ebola outbreak also exposed the weaknesses of healthcare systems in West Africa and emphasized the importance of international aid. Economic impacts. The Ebola outbreak severely impacted West African economies. Key sectors such as agriculture, trade, and mining came to a standstill. International trade restrictions and travel bans further isolated regional economies. Recovery efforts required significant economic aid and reconstruction programs. COVID-19 pandemic, 2019-present. Disease and effects. COVID-19 emerged in December 2019 in Wuhan, China, and quickly spread globally. The World Health Organization declared it a pandemic on March 11, 2020. The pandemic is considered one of the most significant health crises in modern history, leading to widespread social, economic, and political changes worldwide. Virus and symptoms. COVID-19 is caused by the SARS-CoV-2 virus, part of the coronavirus family, which leads to a severe respiratory illness. Symptoms include fever, dry cough, fatigue, loss of taste and smell, difficulty breathing, and severe lung damage. The virus spreads through respiratory droplets and can cause serious complications in individuals with weakened immune systems. COVID-19 has resulted in millions of deaths worldwide and placed an immense burden on healthcare systems. Despite vaccine development, the virus continues to mutate, and the pandemic's effects are ongoing. Psychological and sociological impacts. The COVID-19 pandemic created widespread psychological stress and anxiety globally. Prolonged lockdowns, social isolation, job losses, and uncertainty led to increased rates of depression, anxiety, and other mental health issues. The pandemic's social distancing rules and cancellation of public events also reduced social interactions and weakened community bonds. However, many communities showed solidarity, with people supporting each other through these challenging times. Economic impacts. COVID-19 deeply shook the global economy. The pandemic brought production and trade activities to a near standstill, causing millions of job losses and halting global economic growth. Governments announced large stimulus packages to prevent economic collapse, yet many sectors were severely affected. Tourism, aviation, entertainment, and retail were among the hardest hit. The pandemic also accelerated digital transformation, with remote work, e-commerce, and online services becoming more widespread. This detailed account examines not only the health effects of pandemics, but also their psychological, sociological, and economic consequences. Each pandemic has left a deep mark on its time and region, shaping societies in different ways.